Hi, and welcome to this edition of the HealthHubble podcast. My name is Carrie Plummer, and I am the editor and content manager here at HealthHubble. Today, I am thrilled to introduce as my guest Frances Robinson. Frances is a registered dental hygienist who works in and around Harley Street in London. Having qualified from Cardiff University, Frances went on to study a Master's in Public Health at University College London, and is now not only an active member of a premier dental hygienist study club, but also has presented research at international conferences. Frances is dedicated to the education and promotion of dental health on an international level, and has previously volunteered in Nepal, India, and Cambodia. And she's also written articles on refugee oral health. She also volunteers for a dental charity called Dental Mavericks, who work tirelessly both in Morocco and Lebanon. So without further ado, welcome Frances. Thank you so much for joining me today.
Thank you so much for having me. That was quite the intro. It's weird to hear all your sort of past experiences summed up like that.
Well, all true. So I guess for those who are tuning in for the first time and don't necessarily know a huge amount about you, perhaps let's start with who you are and what you do.
So as you said in my wonderful intro, I'm a dental hygienist working in London. I mostly work around the West End, so sort of the Harley Street area. And also I do one day a week up in Hampstead. Being a dental hygienist means you're more commonly put into general practice. So you work in a big team of dentists, dental nurses, practice managers, and yourself. So it's a very multidisciplinary team with quite structured job roles. Mm-hmm. So we as hygienists, we work to prevent and treat gum disease, to educate patients on their oral hygiene and their oral health, making links between oral diseases and systemic diseases, trying to highlight public health messages to the population. We support specialists. I work with a number of fantastic prosthodontists, endodontists, orthodontists, we all work together to try and improve the health of our patients. So it's quite a diverse job. There's lots of job opportunities for DCPs. We're sort of colloquial known as dental care professionals. Primary care, secondary care, hospital care, you'll find us in any of those settings, really.
That's just a fantastic summary. Thank you so much. For me personally, my dental hygienist is a firm appointment always in my calendar, and I know she's been super helpful with all of my oral health. Now, you obviously work in clinics around central London. What is the best bit about what you do?
Definitely meeting people. I'm a massive people person. I sort of thrive off interpersonal relationships, so definitely one-to-one contact is something that was always a massive factor for me when deciding on my career. Mm-hmm. I kind of always knew I'd want to go into the dental world, actually, but definitely the medical world. I love sort of bridging the gap between being educated in a very specific topic like dental hygiene and then sort of bringing that to the general public. I love sort of oral health promotion and trying to make those links. So that's something that's really rewarding for me in my career on a day-to-day basis.
It's just brilliant. So what motivates you, and what do you like to do outside of clinic?
Outside of dentistry, I a very active, sporty person. Again, love team sports because of those sort of interpersonal relationships and sense of community. I play touch rugby with a team. I captain the Clapham Ladies lacrosse team. You can always find me on some kind of sports pitch or running back from work from central London to South London most days, or cycling to and fro. So yeah, definitely always active. My ideal weekend would revolve around sport and an occasional pub night and some good wine. So that's definitely like to keep the balance sort of in check, really.
It is all about balance. You're quite right. Now, you've written a couple of articles for us that we proudly host on our website, and we've shared through our social media. And it's been fantastic to see our followers resharing that through their networks too. One of the articles that you have written specifically looks at who should see a dental hygienist and guidance on how to clean your teeth. Are there any common themes that you see within clinic, and maybe possibly hidden enemies to our dental health that perhaps we don't necessarily consider?
Definitely. I think there's a lot of misinformation out there. There's a lot of things that are recommended by people that aren't professionals, that maybe aren't evidence-based, maybe even unsafe to different people. So I think sort of making sure we're always coming from a scientific background. Obviously, people's personal experiences are really important in, say, a product recommendation, but it has to come from a place of evidence, really. That's what we kind of stand for as a dental profession. So yeah, I think my sort of top tips for oral health from a hygienist point of view is an electric toothbrush. If you can, if you're able, 100% all the time, electric toothbrush is the way forward. You can get far more strokes per minute with an electric than with a manual. Even if you think you're doing a really good job with a manual, if you go to an electric, you will realize the difference. You'll get a real squeaky clean feeling after your brush, and you won't want to go back. So sometimes it can be a bit of a development process getting someone to make that change, but it's definitely not one that people tend to go back from. So that's something I really stress to my patients. With the brushing, I also really reinforce how we don't just brush the teeth, we actually brush at the gum line. That's something that people, I remember telling a friend I went to university with, yeah, you need to brush where your gums and your teeth meet. That's where the plaque builds up. She said, oh my goodness, I had no idea that that's actually where you're meant to brush. I said, yeah, you really need to be brushing that line between the gum and the teeth where the bacteria start building up. So if you turn your brush towards the gum line at a 45-degree angle, both with an electric or if you're still using a manual, that's how you're getting rid of the plaque in the most effective way. Furthering that, always a fluoride toothpaste. I know we've both spoken about this before. The fluoride toothpaste is the only thing that promotes remineralization of the enamel. Anything that we eat contains sugars and acids which demineralize the enamel. The saliva can help buffer that back, but it also needs a little bit of help, and that's where the fluoride toothpaste comes in. So that's something that even from a really young age, they make children's toothpaste or even baby toothpaste for teeth that are coming in really young. So that's always something to bear in mind when you're reading on the back of a packet, for example, in Boots or the supermarket. Always make sure that your toothpaste has got fluoride in. Again, with keeping your teeth nice and healthy, flossing or using interdental brushes every day is so important. It's something that's often neglected because it takes a bit more time. It's maybe a little bit tricky to get right all to the back and in between all the teeth. But it's definitely something I can notice those patients that do and those patients that don't. And even historically, even if they maybe weren't that good at flossing, but now they're better, I can see where their fillings might be in between the teeth. So that's showed over time that even though you're not noticing it day to day, as a build-up, you're then influencing that part of that tooth in a bad way. So that's why you'd then get decay in between the teeth. There's a lot of interdental aids out there. So floss tape, the little floss harps that look a little bit like a catapult, they're brilliant for people that need to sort of practice. It's a great way to start brushing in between, as well as interdental brushes for larger gaps. They're definitely one of the best things. Furthering that is limitation of sugar. That's a huge thing, something that sort of veers into public health and nutrition and dietetics, and that's something that I really try and stress to my patients, but also from like a public health point of view as well, that if we're constantly snacking on sugar throughout the day, that is really bad for the teeth. We need to be limiting sugar to meal times, so the teeth come under fire from the acids in the sugar for less time each day. So continuing on about acids, I think that's also something that we've talked about a lot before. That there's a lot of misinformation out there in terms of like lemon water being cleansing for the gut and for your general system, but that's something that as a dental professional is an absolute hard no. I have seen people come to me with severe cases of erosion from drinking lemon water and from having healthy smoothies, healthy shakes and juices, because it is so strong. That acid it's naturally occurring, but it's not to be underestimated, the strength that can have on the teeth, and it basically just wears down the enamel over time. So definitely limit any lemon water. Even fizzy water has got acid in. That should be limited to meal times only. If it's gin and tonic on a Friday night, it should be through a straw, and a reusable one at that. So yeah, I'm not being a killjoy when I say limit those diet sugars and be more aware of what we're eating and drinking, but it's just being more responsible for the timings of them, really. That's actually been proven. It's more linked to frequency than quantity. That's been proven again and again by research. So it's definitely, trying to sort of limit how much time we spend with acids and sugars in our mouth.
For sure. I mean, I remember the first time that we spoke, and that was quite a few months ago now, and I had no idea that the fizzy water, the carbonated water that I was drinking in this kind of view that I was taking on more water each day, actually was having a real detrimental effect. So from speaking to you, I've been able to share that to kind of like friends and family, and you're quite right with the citrus water as well. That again is another thing, but it's all these things that, you know, that seeing a dental hygienist like yourself and like your colleagues, it's all of this education that I think that, you know, we all need.
And I think something furthering that is that after we've had something acidic, we shouldn't actually brush straight away. We should leave it 20 to 30 minutes after we've eaten anything, actually, until we brush. That's also something that I see with people that maybe have problems with sickness, if they've maybe suffered from an eating disorder, or if they have acid reflux. We should always leave it 20 to 30 minutes. You can use a mouthwash in that time, but if we brush in that window, that's when we can really damage our enamel even more. The enamel is really soft at that point, so if we brush then, we're really damaging the enamel. So that's really something to bear in mind as well.
Wow, thank you. Now, you are, as I've already said, a seasoned volunteer, having worked internationally to promote oral hygiene around the south and west of Asia. And you are a volunteer fundraiser for Dental Mavericks. Now, for those who possibly haven't heard about this charity before, can you tell us a little bit about what their aim is and how they go about providing help and support?
So, thank you. I have worked already in what has actually really been quite a short career so far, but hopefully will continue to be a very long one. I think throwing yourself in at the deep end is definitely something that I completely stand by, and my charity work was definitely that, and it's now something that I couldn't be without. Dental Mavericks is an amazing charity supporting vulnerable Lebanese population, but also the refugee population there as well. So we work in Lebanon, Morocco. We work with both children and adults. We run daycare centres, sort of an oral health programme prevention schemes. So we do toothbrushing and we do preventative dentistry, like applying fissure sealants and fluoride varnishes to children that need it. And then something we also started doing more so after the explosion that happened this year in Beirut was to help provide emergency dental treatment to those people that needed it. There was a lot of people with head and neck trauma that needed treatment and couldn't afford it. There's also a lot of dentists in Lebanon that are highly trained. They had fantastic universities. great equipment, great knowledge, and they're best placed to treat their own. And that presents a lot less problems for us as a charity in terms of trying to take over equipment and, you know, sort translations out and things like that. So what we're doing now as a charity for adults is to pay a Lebanese dentist to do that work. So a patient approaches Dental Mavericks independently.
Yep.
We then link them up with a Lebanese dentist on the ground who will then provide that treatment. We then pay that Lebanese dentist their fair share of that treatment, and then we do an evaluation and an aftercare plan for that patient as a charity. So yeah, that's something that is working very well. It's also something that needs constant support. The humanitarian crisis in Lebanon isn't going to resolve itself anytime soon. There's multifactorial reasons why that crisis is evolving, and none of them are going to be resolved. So it's something that we are really keen to carry on doing. The economic situation will mean that less people are able to access care and to be able to afford it. So the more money we can raise to treat vulnerable people, both Lebanese and Syrian and other refugees, then the better, really.
Yeah, it's a fantastic charity. Now, if anyone tuning in would like to find out more, and obviously this year has been slightly different with COVID and the restrictions that have kind of been put in place. So, but if anyone would like to find out anything further, perhaps as a clinician, maybe interested in volunteering opportunities, or whether as a member of the public looking to potentially donate, where can they find out more information? Where would we signpost them to?
Yeah, definitely. Our website is pretty thorough in terms of explaining what the charity does and how you can help. That's Dental Mavericks. Just Google it and it will be the top one that comes up. So yeah, they'll, in hopefully a post-COVID future, there'll be volunteering opportunities in Morocco. The trips get quite booked up quite quickly, but also we have scope to be able to provide for people that want to come. And the more trips we do and the more projects we can work on in the country, then hopefully the more places we can then make available. We even offer places to final year dental students for their electives, and that's something that we can support as well. Obviously it requires a little bit more logistical management, as they need to be overseas, but that's something that we're really keen to push as well, that students are also very, very welcome. So yeah, from a donation point of view, we take equipment to Morocco, so any clinicians that have still in date and safe equipment and disposables to use, then we're very glad of them always to take away with us. And any practice fundraising, you know, bake sales and things like that, or a charity run, we're very happy to have you fundraise for us. So yeah, definitely having a look on the website. There's just a donate button that takes you to a Just Giving page as we're raising funds for the Beirut Emergency Dental Fund at the moment. But that is also ongoing. So if there's any sort of practice or corporate sponsorship out there that people would like to get involved with, then we have packs to be able to provide that as well.
That's just fantastic. Thank you, Frances. Now, finally, as a successful clinician, somebody who's travelled the world, someone who has a very full itinerary an awful lot of the time, what is the one piece of advice that you, if you could, give to your younger self?
I like this question. It's very, yeah, I think my motto in life, in hindsight, has definitely been say yes, even if it scares you, work out a way how. Because I had only been qualified a year out of dental school when I first went to Nepal and did my first dental charity trip. And I don't think it's an understatement to say that it changed my life.
Yeah.
It's led me down a slightly different path than the one that I thought I would go down, straight clinical dentistry. I even wanted to be a full dentist in my early days. And now I think that in that way you make your own career path. And if I hadn't have gone to Nepal, I wouldn't have done my master's at UCL in dental public health. And I wouldn't have been so enamored by global oral health. And therefore, doing my dental Mavericks charity work. So I think, just having the confidence to put yourself out there and forge your own career path is really important. My friends at dental school were all very, very surprised that I went and did my master's at UCL. It wasn't something that any of us really considered. It wasn't something that hygienists especially really did, was like further study. But when I qualified, I remember saying to my mum actually that I felt like a sponge. And all of the time I spent post-qualification, my brain, the sponge, was kind of shrinking. And you go through your school and your university and then into your career, and you're constantly learning and constantly changing and evolving. But when you qualify in a role that's as dictated as ours, it's really important to keep learning and to keep filling up that sponge, to keep evolving your career in the way that you sort of see it going. And for me, my public health stuff is something that I'm totally passionate about and that I will always have. But sort of having that patience to let things settle and to kind of just take things by the horns as well is definitely something that I would tell my younger self. It kind of, you make your own luck, you make your own career, and use your network, get out there and sort of just go for it. I think a bit of a cliche thing to say maybe, but
no, I don't think so. I think that's fantastic advice, and it's something that sits kind of quite firmly in my camp as well, of not being afraid to take the leap. And actually, you can never learn too much. Life is part of a learning path. Frances, thank you so much for your time today. So for those people that may want to read some articles that Frances has written, you can hop on over to our website, and that's healthhubble.com, and you'll be able to find within our article section under dental health, you'll be able to read Frances's articles. Equally, you can also hop onto Instagram, where Frances is a very active member under the handle of @theGlobalHygienist. Frances, thank you so much. It's been a real delight speaking to you today. Thank you so much for your time.
That's okay. It's been brilliant speaking to you. And I hope our listeners get something out of my oral health advice and take something away from today. So thank you so much for having me on.
Thank you.